Vitamin B12 is a deficiency that we certainly see in both sleeve gastrectomy and in gastric bypass. We see it at about the same rates in both of those procedures, and that's because we operate on the stomach. So the stomach plays a really important role in how B12 is absorbed in the body, and for a couple of reasons. One is most of the protein in your diet most of the B12 in your diet is bound to protein, and when we take that in food, your body has to use acid to separate the B12 and the protein. So we don't have as much time or contact with acid in those procedures, either because we've bypassed significant parts of the stomach or we removed part of the stomach, and so that process changed. But the really key thing is this little thing called IF, or intrinsic factor. This is made by specialized cells in the stomach, and in order to absorb B12, we have this really interesting system where we break it out of food and then we bind it to this stuff called B12, and that stuff travels all the way through to the most distal part of your small intestine, and it's actually that complex that by and large gets absorption done. So in gastric bypass, all of the area where that substance is made is bypassed. So you just get no contact with it anymore. And in sleeve gastrectomy, most of the cells that make intrinsic factor are actually removed. So it really makes a big difference. And we can see rates be very high in people who are unsupplemented for B12 deficiency in both of these procedures for that reason. So can the body still absorb some B12 without intrinsic factor? Yes, but it's about 1 to 3%. So it's a really small amount. So usually your doctor will recommend that you do something else. It might be injection, it might be prescription nasal spray, it might be a sublingual tablet. And this is one where, you basically, if you've had a sleeve or you've had a gastric bypass, you will do it for the rest of your life. We do see deficiencies in some of our other procedures, but at much, much, much lower rates than in those two procedures, because it's the operation on the stomach that really makes the big difference for this particular nutrient. So when we see B12 deficiency, it can be quite what I call insidious in onset, because you actually store some B12 in your liver. So this can take a very long time to develop if it's going to happen. So that's another thing that can be deceptive, is people's levels can be fine, and then at 5 years, 7 years, 8 years, it can take a long time. And the symptoms can be really vague. Fatigue. Anybody get fatigued? I'm a little fatigued today. I got to bed late last night, and that's often the first symptom. It's just some fatigue, and we might not, give that any credit at all, because we get tired sometimes. And people get irritable. Oh, okay, I have a teenager at home. I get irritable sometimes. And then other things like these symptoms of neuropathy, where people get numbness and tingling in their hands and feet, things like that, those can take much longer to develop. So, the important message always is to be a little bit aware of what some of these symptoms are. And if you start to have them, don't wait. Let your doctor know, because usually if we catch something like this early, we can get it turned around very quickly. It's when people let it go on for a really long time and they don't report it that actually some of the damage can become permanent. So if you start to have some symptoms, particularly of neuropathy, you want to always tell your doctor about that.